turnout, and I'm thankful for all of you. I'm going to do Mikhail's introduction today. Mikhail Shneyder is the founder and chief executive officer of Nightingale Education Group, a mission-driven organization focused on innovative healthcare workforce development across entire professional continua. From certificate programs to graduate studies to reskilling and upskilling through continuing education, from 2012 until 2023, Shneyder served as the first president of Nightingale College, a higher learning institution dedicated to closing education equity gaps and creating geographic, socioeconomic, and demographic access to the nursing profession.
You're doing all right, Bree.
Taking a breath. Creating thousands of new nurses throughout the United States. A visionary leader and a registered nurse for more than 25 years, Shneyder has a wealth of management experience in post-secondary education for health professions and healthcare delivery services. He is a published academic author, conference speaker, and guest lecturer specializing in strategic planning, organizational development, forecasting, and management. Shneyder holds a Master of Business Administration degree from University of California at Berkeley Haas School of Business, and he was also named as a Utah Healthcare Hero in 2022. Mikhail Shneyder.
All right. Yay. Thank you. Thank you, everybody. Hello, people out there in cyberspace as well. And good afternoon to those of you in the East and Central time zone, I guess, right? Well, like, what's the Central 3 hours? Yeah. Oh, yeah. Afternoon, definitely. Okay. So welcome to the Future of Nursing. For the purposes of this, today, those of you in the cyberspace, you have your chat going, so participate through that. Every once in a while, Brianna's going to raise her hand if there's something that is really, really interesting that's happening in the chat, and we're going to pause and see, and she'll read us some questions or comments. And then those of you in the cyberspace, because look, it's like really easy to keep attendance in 3D, for real, right? I'm like, you're here, yay! In those of you in cyberspace, every once in a while, there is a question, and I'm going to ask this question here as well, but a question is going to pop up in your chat. It'll be pinned to the top of the chat, so go ahead and click on the link and go and answer that question. To the best of your knowledge, and then, yay, it'll be counted like you've been here. And we're going to have these the questions throughout. Okay, so another important sort of note. For the purposes of today, and hopefully for the purpose of the rest of your career, I would like you to turn off the chatter of the TV boxes, or whatever, flat screens, or wherever else you get your misinformation. So, like, turn it off. Take off the hats. Everything that says this political party, or that political party, or whatever else hat you're wearing. And for the purposes of today and the rest of your career, wear the nursing hat. That's who you are, and that's what I'm asking you to do. Now, if you look at the world through the nursing lens, it looks very different than whatever anybody tells you on TV, right? And it requires different thinking, different sort of solutions. It requires you to collect evidence in order to state absolutely anything, right? Talking heads on TV, ever heard them? It doesn't matter which channel you pick. It's like people sort of go like, and pull it out of their ass, literally. Not based on any kind of reality or evidence. Where do we find evidence? Where is evidence? That's the first question for you all. Studies, right? So there is certain organizations that are non-political, non-partisan, that just study things, right? They sort of collect their research, collect evidence, they put out reports. And do you know any of organizations like that in healthcare? that specifically looks at health care. I'll give you a couple. One is called the Commonwealth Fund. So the Commonwealth Fund, they research healthcare throughout the world. They research healthcare to the county level in the US as well. So they research outcomes and best demonstrated practices and so on and so forth. So this is a really good source of evidence for things. KFF, another good organization, again, nonpartisan research, they just produce that. Now, nursing is supposed to be an evidence-based profession. Heard that yet? Like by the time you got to us, like that should have been the very first thing. We don't do anything unless it's evidenced, correct? We can't just look at a person and go like, oh, I know exactly what you're experiencing because I see it. There is a gut feeling. There is an intuition. Don't get me wrong. After a while, after you've practiced nursing for a while, you walk in the room and you whiff and you go like, oh, I know exactly what that is. And that is fine. So experience is good, and as you're gaining that experience, as you gain it, use it. Absolutely use it. However, do not forget that your personal own experience doesn't substitute for actual evidence that is out there. So keep that in mind for the purpose of today's discussion, because I am going to ask some provocative questions. For example, who should be excluded? Let's think about that. Whom should we exclude from care? No, really? No one? But what if they've done something like horrific? What if their skin color is a certain orange?
I think they already do exclude women.
Do, yes. Should. I'm asking should.
No.
Whom should we exclude? What if they're in prison? What if they're like made an error? And smoked some weed and then got locked up. Oops. Yeah, should we just like, no, you're a felon now? Nope. What if they suffer from a substance use disorder? Should they be excluded? Because they brought that thing on themselves. No, everybody's saying no. Shouldn't. Yeah? Does everybody feel that? Do you believe that everybody has that right? No matter what. Why do they have that right? They're human. Now, if you'll be the first human to raise your hand and say, I have never made a mistake, I'm just absolutely perfect, the heaven's gift to humanity, then you can, start excluding folks. Until then, I think we can agree that no one should be excluded. Oh yeah, ta-da, title slide. So, with that, I'm going to give you the punchline of the entire talk right away. And this is this. Anybody have seen this before? Okay, so this comes from the report on the future of nursing that was published by the National Academy of Medicine in 2021. The report was delayed. You know what happened in 2020? All remember it? Yeah, like it was yesterday. COVID happened, yes. And everything came to a halt because, no evidence of any kind was available for anything. And so it's difficult to navigate when that happens. So this report, which is titled Future of Nursing 2020-2030, was published in 2021. This is the second report that the National Academy of Medicine publishes on the topic of nursing and nursing care and how it is the backbone essentially, of the healthcare in the United States. How many, let's get that out of the way as well. How many nurses do we have in the US? Licensed nurses.
One for every 100 people.
More than that, more than 1 for every 100. Yeah.
Yeah.
Like a number.
A number.
Anybody? Approximate. Nobody knows the exact, but approximately. No. Double that, 2.1 million, and you will get to a number that is somewhere within the ballpark of what actually is. So we have around roughly 4 million. If you add all of the RNs and PNs together, we're well over 4 million. And so, and it's more than 1% of the US population are licensed nurses. You would think we would be the healthiest country on the face of the earth because no other country has this level of supply already. So, are we the healthiest country on the face of the earth? No. How do we know? Evidence! Yay! And we're going to explore that evidence. But before we do, this is what the report says, and I'll read it for you. We will never thrive as a country unless we all have what we need to live a healthy life, no matter who we are or where we live. 2, nurses are the catalysts for this change. They're trusted bridge builders who collaborate with people, communities, and organizations to promote good health and well-being no matter one's background. 3, for our country to advance health equity for all, the systems that educate, pay, employ, and enable nurses need to permanently remove practice barriers, value their contributions, prepare them to understand and tackle the social factors that affect health, and diversify the workforce. Now, I'll let you sit with it for just a second, and I'll ask you this. What is health equity? And why is it important? What is health equity? Equity, ever heard that word? It's a popular word. I think many people say it, not many people understand it. What does it mean? Yes. Value. What do you mean?
Value in something.
Having value in something. Well, perhaps. Equity. But if we take 2 people, what would make them equitable? Any 2 people in health terms. The what?
Good collaboration.
No. But like, what does it mean to be equitable with somebody else? To have equity with somebody else?
Equal is not equal.
Equality and equity, different things. So what is equality? Maybe that's easier. What is equality? Heard that word as well, right? Equal rights. What does it mean? What does equal mean? The same. Absolutely, that's what it means. The same. Everybody gets the same. No matter what. Okay? I mean, we'll set the equality piece aside. What is equity then?
If it's not getting the same,
Different.
So it's getting something different, but getting to what? To each their own, correct. For what purpose?
so what?
Their health.
Their health.
Right, but what kind of health?
Individualized.
What?
Individualized.
Individual.
Wise, very good. Yes, we're getting there. We're all different, right? Everybody agrees? And all of us need different things. We need access to different resources. We need just different stuff because we're all are very unique in our humanity, essentially, and where we are on the spectrum of it and health spectrum, correct? But it's getting what one needs to get to equitable outcome, the same, essentially, or comparable outcome to everybody else. How are we doing with comparable outcomes in the US? Well, if you're Mikhail, kid you not, you made it. Good for you, Mikhail. Awesome. Yay. Healthy as can be, even at 50. You know, looking spry, running a coastal trail in Anchorage on a Monday morning. Yay! Yay! Is everybody Mikhail? No. Does everybody has access to everything I have access to? No. By the way, I did not have that access when I first immigrated to the United States at the age of 19 as a refugee, not speaking any English whatsoever, living in poverty for years, doing all sorts of jobs to make the ends meet. Wasn't born with it. Truly. Got there. Lucky. Lucky. I was lucky. Not everybody is. Now, should luck dictate health outcomes? No, you're like shaking your heads, no. No, luck shouldn't dictate health outcomes. What should? Evidence, yes, and the systems that are built to promote those health outcomes. Obviously, if somebody says, no, I don't want it, like I don't want to be healthy, fine, absolutely fine. There's very few of those folks. They're like, nah, not interested. Why is health important? Why is health important? And Bree, that would be the first question.
I knew it was coming.
All right.
The minute I did that.
Why is health important? Think about it for a minute. Yes.
Yes, please.
For living a quality life.
Living a quality life, right? What does it mean? What is a quality life?
Fulfilling life.
The what?
A fulfilling life. Something.
Fulfilling life. Yeah. Sort of joyful life, perhaps. Okay. What else? Why is health important? So on an individual level, right, it's living your best, having a fulfilling life, joyful, not constantly hurting everywhere. Just tell it to my wrist and overuse tendonitis. That it's too much of this, I think. I go around and I wave at people, and therefore, okay, why else? Why is health important? Why is it important for a community? Go ahead.
Well, and by having good health, we're able to keep the economy working with having jobs and people who are able to be in those.
Do stuff! Yes, absolutely. So health is fundamental for the economy to be able to function really, really well and grow and develop. And as the economy develops, all participants in that economy are better off on average. So, and if it's a sickly population that is not joyful, that is completely, isolated and depressed and all of this, yay, welcome to the United States of America. It's not going to be as good. Nowhere near its potential. So yes, individual health is important on macroeconomic level, and then for communities as well, right? If a community is healthier, it gets together, it does things together, it supports each other. It does this whole social thing that we have forgotten. And we'll get to that a bit later. But yes, fundamental. Maslow, anybody studied Maslow for like 20 minutes in your general psychology class? Remember the pyramid? Yeah. What's on the very bottom? Physiologic, yeah. Physiologic needs. Health is there. Health kind of circles that, safety and physiologic needs, and then it expands into love and belonging, which is the social health. You get to that. And it expands to esteem, which is really, it's emotional and mental wellness, right? There are 8 dimensions in total, to wellness. 8 dimensions. Sammy, would you send me a note to put the 8 dimensions in here? Since this is the several times I've talked about it, I forget to put it in. 8 dimensions. So we already mentioned physical, emotional, social, mental. What else? Other types of wellness that you, as nurses, have to pay attention to. Yes?
What is it?
Hermione, you already said it, sorry.
Okay. What?
Come on. Wellness. In which other ways one may be well. And all of us should be. Come on. I said physical, we said social, said emotional, and we said mental. Spiritual, very good, yes. Doesn't mean, it's mandatory Sunday morning service or whatever night or day or however else one might observe, but spiritual wellness is important. Even for agnostics, even for those who don't believe at all into any kind of higher power, right? Sort of understanding that things go beyond you alone. That's where that connection's, even if you build that connection with other people, it still is important. What else? Anybody independently wealthy? Raise your hand. Okay. Thought so. Hands? Wellness? Money, yes, financial. Financial wellness is important. Occupational wellness is important. Loving what you do in the first place, right? That's why I asked that question ahead of time. Why nursing? What's in it for you? It's a really, really tough job. It is, no matter where you are, no matter what your practice setting is, it is tough to do. And unless you're passionate about it, it becomes unbearable. So find your why, right? Understand why are you connected and why it's important to you. And then you will take that first step, and you already, obviously, many of you did, on the way to occupational wellness. All right, okay. So any other thoughts or anything out there, Bree? How are we doing so far? Okay, we'll love feedback. Okay. So we said, you said, guys, we're not doing that well in the US in terms of kind of health outcomes, health equity, all of this. How unwell are we? The what? Extremely unwell. Well, everything is relative, right? If you compare the United States to some kind of Central African nations, we're winning. Yay. Can beat ourselves in the chest. All of this. However, if you compare us to the rest of the developed world, countries like Canada, France, Switzerland, Sweden, New Zealand, Germany, the UK, Australia, Norway. We're down there. That's us. Right down there. Comparative healthcare performance score. By the way, I will send you the slides, or somebody will, after this, so you don't need to take, Brienne will, you don't need to take, bless you, pictures of this. But, so yeah, not doing fantastic. You can slice it another way, and this is the how much we spend on healthcare. See, like the rest of the countries, they're like kind of clustered over here as compared to their entire economies. Gross domestic product is the size of one nation's economy. So this is our, and then, this is per capita, meaning the entire economy production divided. Everything that's produced in an economy is divided into all of the population that's counted, and then you get there. So our GDP per capita is at about 70,000. That's the entire economy per capita. And we spend close to 14 of that, 20%, very near, on healthcare. That's part of that 70. Now, and it's been growing and growing and growing and growing. And the economists say that this rate of growth is absolutely unsustainable. Now, why we keep spending and spending and spending and spending? By the way, so as we go through this and we look at the evidence, I'm going to ask you why, your thoughts on what do you think leads us here, and then what do you think you can do, even as a learner, or certainly after you get your license as a practitioner in nursing, to change that. So, any immediate thoughts? I'll show you another one on spending. Everybody's kind of like there. Winning! Spending the most, getting the least value out of it. The least outcome for what we spend. So, thoughts? Thoughts on why? Oh, there are many, many, many things. Give me anything. What we eat. Very good. Yeah, what we eat is kind of sad. Really. What else?
There's not a lot of regulations on what we consume in this country, and I feel like that's definitely one of them.
Yeah, and we consume everything. We are lovely as consumers. We're very obedient. We consume food that's not good for us, knowing that it is not. We fill our lungs with, now it's the kids, I love it. And they saw the dragon show, and now it's like everybody is a dragon. Peach, but it's peach. And it's delicious. We consume social media to the extent of where the Surgeon General just a couple of days ago called for putting warning labels on social media platforms that clearly state that consumption of social media the way it is done today is harmful for teenagers' health and mental health, kids and teenagers. We love our consumption, though. Nobody can tell us stop scrolling, right? Now, just because the word social is in the name of it, doesn't mean that it is that thing that contributes to social wellness. As a matter of fact, it's a thing that takes away from it constantly, from social wellness. And yet we're like, oh, look at my 500 friends. For real? Yeah? It is impossible for you to even remember names of 500 people. Truly. Let alone be friends with them. When we had about I stopped doing it after about 100 learners when we were first growing. I was like, okay. And then I stopped doing it with collaborators as well because there's just no way. So, yeah, we consume. So all that we're describing here, right? These are the social, societal factors or drivers of health outcomes. Yeah? Everybody good? Okay, should we look at the next one? Yay, we're having so much fun. This is broken down by where we spend on healthcare. So inpatient and outpatient care, quite more than anybody else. Now, does everybody has access to that care? No. So this is really those who have accessed care in the first place. Way more than anywhere else on actual services where doctors, nurses, other practitioners are involved in providing, right, facilities, so forth. See that purple one? That's medical goods. Most of it is pharmaceuticals. And then if you run that down, nobody come close. I mean, Germany, but not as close. See that green one? That's administration. This doesn't count administration within healthcare system, facilities, and so forth. This is administration outside, insurers, Medicare, Medicaid. Those are billions of dollars every single year. We're winning. Long-term care? Old people. Why should they just die? Shouldn't they? Everybody else spends way more. Now, okay, raise your hand if you see your future in acute care. Don't be shy. Okay, a couple. Well, a couple is all right out of this crowd. Yeah, not too bad. Initially some years ago I was getting everybody's going into NICU. Newsflash, you're not. And that's not where you need it. Based on this discussion that we're having, based on the facts that are being presented, think about where the need actually is. For your talent, for your passion, for your skills, for your competencies. How are you going to support the health of your community? That's an important thing to start processing. It's same thing, sliced different ways. How do we perform for our money? That's everybody. Welcome, and then us. Spend the most, get the least. Why? So behavior, we said, right? Our consumption behavior. What else? What else? Policies, yes. Tell me more. What kind of policy? Restrictive policy. Well, give me an example.
When doctors ask for certain treatments, have to go through a bunch of hoops to get insurance to cover.
Right. So again, anytime something is not covered, right, is cheaper, certainly, right? Whether it should or not, that's another question. This shows what we've already spent. This is the actual spending, right? So there's nothing that wasn't covered or wasn't performed is a part of this. It wasn't performed, right? Covered may if it's not covered, it still is here, but it's out of pocket kind of spend and so forth. But so why? Societal barriers. What else?
Well, I know that surgeons, they're looking at possibly being down to a very few amount within the next 30 years because people aren't wanting to spend the money. to go through college. So we're getting an elderly or older aging group of surgeons and doctors that are staying within the force versus getting new and younger who are in learning
It's true.
practices.
So the aging practitioner population, similar is true in nursing, right? The average age is in the 40s of a nurse. So it is an aging workforce, but it's an experienced workforce as well. So you can't necessarily say that is the issue. Perhaps the shortage that is created by the aging population exiting the profession and the new entrants not getting in, that certainly affects this, right? Where we have to pay overtime, we have to pay travel wages for nurses, right? Because there's just not enough in order to cover everything that is needed or required. So that is true. What else? What else? Why are we spending so much? And the most of what we're spending is in acute care. Insurance cost is insurance. Insurance negotiates with. This is where administrative costs come. Every insurance company has to negotiate with every provider, right? On what that's and for same procedure of the same quality at different providers costs different, right? Us as consumers, we don't know because what? It's $25 copay if you're covered, right? It's like, what do I care? Where do I go? Remember your behavior on Amazon? If it's 1 cent less, I'm going to get it from that seller. Yet healthcare, we're oblivious of what things actually cost. So yes, if we comparatively shopped for the same stuff, we would have spent less. So there's no comparative shopping. What else?
Does it have to do with unnecessary testing?
Unnecessary tests and unnecessary care, absolutely. And there's, I'll give you some figures on that a little later. Yes, there's a bunch of stuff, right? Because we're a consumer-driven kind of society. And if we have access, we show up at the doctors, we stomp our foot. Bless my mom, like she's fantastic. And she survived cancer. She survived many, many things. And yet, she's like, hurts. Do something. And the doctor says, you have to lose weight. And mom comes home and gets me and is like, dare she suggest that I lose weight? She should look at herself. I mean, I get the point, right? If you're like, do as I say, not as I do, never is a good strategy, not in parenting, not in nursing. But, the fact that mom needs to lose some weight, that is a fact. And as soon as she does, perhaps the pressure on her spine will release a bit, and she will stand up a little straighter, and the curvature will return, and she'll hurt less. And yet it's like, nah, give me a pill. That's how we behave. Give me a pill. I want a quick fix for whatever it is. Yeah? What else? Yes?
I would say going back to the acute care, we just have such a fast-paced lifestyle here that we just work and work and work and work until something physically stops us. So we go in, we try to get that fixed. And then once we're a little bit fixed, we're a little bit better, we go back to work, we just work.
Yeah. Right. So it's kind of societal factors again, and the expectations that are the pressure that is put on us, right? We're the out of Western developed world, we're the only country that works as much as we do on average, right? Hours and hours and hours, and that you don't have time to or anything else. And look, these things do wear out if you don't take care of them continuously and from much earlier age, right? So the reason we are seeing so much in acute care is because any type of preventive, right? Anything preventive or anything that, what ends up, let me ask you this, what ends up in acute care more than anything else? What types of conditions? Pain, true, and it's part one of the it's the same bucket. Yes? High blood pressure, same bucket. Same bucket. What do we call those conditions? Chronic. What ends up in acute care is exacerbations of chronic conditions. Stuff that should have been handled way earlier than before it gets into the acute care system. And acute is expensive compared to everything else. Very, very expensive. So if we continue on this, sort of not managing chronic conditions well, not promoting health well, not preventing diseases well or conditions from occurring well, we will continue spinning and doing exactly the same. Our system is set up as a reactive system. And reactive is always more expensive than proactive. Nowhere else are systems as reactive as ours. Affordability. This is what an average person can afford. Equity. You know how, like, all of these charts, it goes like, and then a cliff, boom. We're off the cliff, peeps. And again, I'm not necessarily giving all of this to you to scare you. Although a good, like, kind of healthy fear here, like, a little bit anxious around what can I do? That is the question that I would like all of you to start pondering and reflecting on and answering. What can I do? You're not powerless. That license, when you get it, is going to give you even more power. So how are you going to use it? You're just going to show up, clock in, clock out, kind of go through the motions, be like, yes for you, yes for you. Oh, no, no for you. Just look at you. We have that, we do. Yeah. Like, I don't agree with you. I don't like your hat. Wrong hat. No care for you. Process that as well. Cost-related problems. So, 27% of people in higher income report cost-related access problems. Half of the lower income population. Half. Nowhere else the spread is as large and the numbers are as staggering. Comparatively, New Zealand, 27% of low-income population reported. Skipping care because of costs. Now, and it's like catch-22. You skip care, the next care is going to be even more expensive. Yeah? So, but fixing the underlying cost problem and doing something about that will then stop perhaps from that wheel spinning forward and forward and forward and forward. Outcomes. Let's talk about outcomes. Big stuff, like life expectancy, for example. Everybody? Us. Everybody dipped, right, in 2020. Why did it dip? COVID, yes. COVID. Don't need to anymore be any kind of dip due to COVID, and yet it continues because talking heads on TV told us that vaccines are implanting chips that track your every move. You know what tracks your every move? Your phone. Facebook. Insta. Insta know exactly what you ate. Yep. And then I have to sell you a little bit more of the same, because obviously you like it. Mind-boggling on vaccinations. Or it's like indisputable proof that vaccinations work. Back in the 50s, 60s, when the polio vaccine finally became available widely, people lined up, ran to get it. Because it saved lives and wellness. It create that joyful life where we can be like normally go about it. Yeah. And yet now, evidence. People forget about evidence. This is evidence. We're almost a full, what is it on there? 5 years. On average, our lifespans are shorter than that in the rest of the developed world. We're the richest country on earth, on the planet. And yet, avoidable mortality. Avoidable. See how between 2009 and 2019, all of the countries, the spread between the top number and the bottom number is the reduction in avoidable mortality. Everybody, you know, in like from low teens to kind of 25% or so in Switzerland. 5. And look where we begin in the first place. Winning. We're fantastic at winning. Just not in the right direction, unfortunately. Yeah. By the way, there will be a break. Yay. We're going to go to about 10:10 or so. You know, between 10:10 and 10:15 we'll break, and then we'll come back for the riveting conclusion of this presentation. That cause of premature death. Causes in the United States. Cancer. And cancer is, as you can see, doesn't much discriminate among nations, right? It's sort of this thing that is there, has to do with environmental factors quite a bit, right? Has to do with what we consume quite a bit. Coca-Cola tells you it's happiness, right? Or whatever it is, lately magic. What's their latest? Twirling, you know, sitting around campfire with friends. The formula is secret. Secret. Because, yeah, if you probably knew the whole thing, you'd go, I think I'll find happiness elsewhere. Constant exposure to chemicals, constant. That are not naturally occurring in nature, just, you know, laying around there, and you go around, you know, hunter-gatherer, berry, this, that, whatever. This is how, you know, tens and hundreds of thousands of years. This is what we did, you know. Wasn't like, yellow dye number 3. Delicious. Has a lot to do with our consumption. But let's look at other things. What's that blue? Heart disease, yeah. Absolutely preventable, people. Absolutely preventable, right? Even some cancers are preventable. Let's talk about that. Which cancer is preventable completely, fully? The what? No. Well, smoking does lead to, and not. I mean, skin could be, right, if you smother yourself in sunscreen on a day like yesterday in Anchorage. Right? The what? Not lung. No. Try again. Yeah, try again. Okay, I'll give it to you. Colon cancer. Colon cancer is the number 2 cause of 100% preventable death. Colon cancer. Why? And whom does colon cancer kill comparatively more than anybody else? Which population? And why? So, question 1, why is colon cancer fully preventable? Come on, must know something.
Screening?
Yeah! Woo! Cheap and effective. Tube up there. Oh, I see polyps. Snip, snip. Before they turn into cancerous tissue. Absolutely preventable. You know, I mean, let alone eating roughage. Man, broccoli, poison. Which group, which demographic group does colon cancer kill more than any other group in the United States? The what? Not elderly, nope. Nope. Men, men, we're getting closer. Men in which demographic group?
Isn't it American Indians and Alaskan Indians?
Not, although men over 50, very good. Yeah, we're getting closer. Black men. Yes. Why? Maybe, don't have access, maybe. More importantly, why? It's not a genetic factor. It's cultural, absolutely cultural, right? First, it's the entire trust in healthcare system, right, which is the lowest among black men. Rightfully so, historically justified. And what else? How many black male nurses do you know? Not very many at all. I mean, men altogether in nursing are, barely creeping toward 10%, being half of the population. So this is where you talk about kind of like, mirroring of why diversification. Diversification means diversifying in all sorts of ways of the profession. Access to bring people from lower socioeconomics into the profession, right? Because somebody who hasn't experienced poverty before, guess what? It is very difficult to relate to somebody who lives in poverty. Or just eat better. You have to dig in as to what can be afforded and how it can be done in certain populations. Diversifying from the gender standpoint, yes, important. There's this thing where, men are more likely to take advice, health advice, from another male. So mirroring and diversifying the profession so the profession starts mirroring the population that it serves is very, very important. Look, not to say that we shouldn't have more white women in the profession. We should, absolutely should. But we also need other folks. And with the shortages, the way we're experiencing them, there's never enough. And then it goes to, the passion of my life, opening educational access, and so forth. So it all interconnected. So I firmly believe what we are doing at Nightingale, down the line, will affect the prevalence of colon cancer in black males and will create or contribute to creating an equitable outcome for that population in that particular thing. So, heart disease, preventable. I'll give you this tidbit of information. Obesity is affecting nearly half, they're stretching, it's only 42%, of the US population. And it ranges, so the severely overweight, that's what obesity is, severely overweight, ranges from a high of 51%, more than half of population in West Virginia are considered clinically obese, to a low of 33% in Washington, D.C. Well, look how small they are, so it's easier to manage. Alaska. How do you think Alaska is doing? Are you above average or below average? Above. Yep, that's right. The long period of where, there's nothing but Netflix. Yeah. Not much chilling probably with it, but yeah. Alaska is above the national average, but not by much. So Alaska is at 43.2%. Now, you can look it up, people from other states, of how your state is winning. I mean, slip of the tongue. Okay, so COVID-19. This is 2020, right? Look how we did. Look at everybody else, comparative to the population. The rest of the developed world did better than we did. Because their populations are like, no, I'll be implanted with chips for government tracking. I mean, if privacy is your concern, funny. Transportation accidents. Transportation deaths. Oh, I love it too. Hold on. I have that too. So the increase in the preventable mortality. And COVID-19 was there, it's serious, but the increase really is attributed to suicides, homicides, drug overdoses, and driving, transportation-caused deaths, which were previously in decline, also rose 15.6% in adolescents. In adolescents. Accidental poisoning or overdose. That's drugs. That's fentanyl. It's an epidemic in this country. Certainly is an epidemic in the state of Alaska. I'll give you some data on that. Not to bring it all down, everybody, but oh, where's my? More than 109,000 overdose deaths in 2022 in the US. That's a big, big number, and it's reflected in that. And then intentional self-harm. We're leading the developed world alongside Japan in suicides. In my home state, suicides are the leading cause of death for people between the ages of 15 and 24 of premature death. Firearms are the leading cause of death among young people aged 1 to 19. Ages 1 through 19. Firearms. All of that included accidents, suicides, and homicides. And yet we're having a discussion of whether guns are affecting health. Almost half of all people in the United States have either experienced or know somebody who experienced gun violence. Nearly half. So is it a health issue rather than any other issue? By the way, more people die by suicide from firearms than homicide, than firearms homicide. Is it a health issue? Yeah. It is mental health issue, right? Is gun control a health issue? Yes. It's about nothing else. I personally don't care about anything else. Go hunt, do whatever you gotta do. In the vast majority of these United States, somebody can be depressed, with nothing working, isolated, and so forth. They can walk in a Walmart or some other store, buy a gun, and before anybody can stop them, kill themselves. Because it's just there. Yeah. Winning. This should be shocking. This is death during pregnancy, but most are after childbirth.
Like within a certain time?
Within a year. It's not even like, can't even begin to compare. 3.6 per 100,000 live births, average of the developed world. We're 7 times, or almost that. Black women die at a rate 3 times that of white in this country, on that chart. How are we doing with equity? This is mind-boggling. We're about 46th, 47th in the world. 46th, 47th, behind the, republics of the former Soviet Union like Kazakhstan and Tajikistan and Turkmenistan and all of the, yeah. The richest country on earth. Multiple chronic conditions, multiple, not just one, multiple. 40% of the population, of the US population, has at least one chronic condition. A bunch of them are kids.
There's a
How long has this been going on? I feel a song coming on. Isn't it like a song like that? Oh, tell me something. How long has it been? For a very long time. For a very long time. We have built a system that is simply unsustainable from the health standpoint, from health outcomes standpoint, from health equity standpoint. We keep arguing about what's good, what's not. Well, mother's dying during pregnancy or at childbirth or within a year afterwards is not acceptable in any, and there's always going to be, you never will get to 100% of anything, right, in any of these metrics. But we can do way better than this. This is systemic. This is built in. This is because the largest profession in the US, healthcare profession in the US, nurses, we're complacent. We don't do enough, nearly enough. We do not use the full scope of our practice and our licenses to try and bend this and change this. Almost 30% multiple chronic conditions. And then you wonder how come it is so. And a bunch of these chronic conditions, again, some of it is genetic, some of it is inherited, and some of it is not preventable, but most of it is. And we spend very, very little on preventing it, on doing anything about it. So, long time. Obesity I shared. By the way, it's this. I love it when I see it on TV. My body, my choice. I can be as voluptuous as I want. Congratulations. Yes, you could. Yes. Nobody's taking taking that away from you. The only thing you should be aware of is let's go. There's 9 conditions, chronic conditions that are associated with obesity. Start listing. Good. The what? CHF. Coronary disease. Diabetes. Hypertension. Kidney disease. Cardiovascular disease. Stroke. It is not without consequence. No matter what Dove says. We are spinning in the world of marketing. The world that spins it all for us. And we keep just going. And it's like, oh yeah, I should get that Axe deodorant. Because as soon as I put it in my armpit, she will definitely appear. She'll be attracted by my scent. And it's one of the more ridiculous and in-your-face examples of things, but it's, pharmaceuticals. We're the only country that advertise those on TV. If only I can pop that, I will be twirling in the hills and doing Broadway numbers just like she's doing. Like that latest, whatever. It's like there's a really good jingle around it. Yeah, something about type 2 diabetes and for real. Dance. I'll leave you with this before the break. And just let you absorb it. We spend 4 $4.5 trillion in 2022. $4.5 trillion. And yet you see the outcomes that we're getting. Shall something be done about it? Any other questions? Yeah, I mean, everybody's like quietly nodding their heads. I want a resounding yes out of everybody. Okay, who is going to do something about it? We is a really good cop-out kind of thing. Anytime it's we, this is what it's been. We, the royal us, are going to do this. And for as long as it remains we, that means no one. The answer that I'm seeking from you is I. I am responsible for this. On whatever scale. You don't have to change the whole world right away. You just have to do something more than what you're doing today. Start with your kids, those of you who have them. You know, and then expand into the community. But we'll talk about the what and the how and all of that after the break. So you all have about 15 minutes. So it's 10:11 Alaska time. You calculate your own in cyberspace. 10:12 now. So be back at 27 past the hour. All right. Well, all right, everybody. Welcome back from break. We're back and we're rolling. And well, I'll start with questions that you have, or comments, or wishes, or anything else. Same for you in cyberspace. Questions, comments, wishes, random thoughts. Yes?
I just feel like it's a lot of information to take in as far as like the statistics behind
Right.
what career leaders. So it's like it kind of does drive me to like what more can I do like for the future.
Yeah.
So I'm excited to hear to say we all can do, but mostly like what I can do to apply it.
Yeah, that's very good. So I'm glad that it's triggering some sort of passion and desire to do something about it. And you can look, you absolutely can, and we'll touch upon those things. I don't have all the answers, right? But the same for me. It's very similar that these stats drive a lot of passion behind what I do and why I do this. It's because where we are is absolutely unsustainable. It is just unsustainable. We cannot continue in this way. And I know for a fact that being more than 1% of the US population, probably good like 1.5, right? Collectively, we're powerful. And if each one of us starts doing something about it as nurses, I think we can bend the unsustainable paths sort of today and how the history got us here and go toward this more brighter future. What other things, other thoughts, anything else? Those who are sitting quietly and just thinking, I wouldn't notice you. Hey. Not in the middle of chewing, though. But anything else? Comments, questions? Learned some stuff so far? Shocking? Perhaps, yes. Oh, the maternal mortality, yeah. Shocking statistic. Shocking. And it's not improving. It's becoming worse. So, yes, question.
Is there somewhere where it is like separated into why?
Well, the reasons behind it are systemic. So we have to sort of dig in, right? And it's like multifaceted. Reasons are multifaceted. It's everything from access to care to the lack of prevention to the ineffective chronic conditions management, and on and on and on and on and on and on, to the nutrition, to all of the social barriers or social drivers of health outcomes. So again, the reasons are multifaceted, and the individually, that I think makes it exciting in terms of what can I do, because you can start absolutely anywhere, right, and dig into it and address your particular thing, right? So as I said before the broadcast, the question was asked, what drives you? And I always wanted to have an impact. I always wanted to have an impact on patient care. Always wanted to, and then my desire to have that impact started kind of expanding from the direct patients that I was working with, because I can only see so many and do so much during a shift, to kind of bigger and bigger and bigger, and so ending up in education and founding this institution really was my answer and continues to be. And I can guarantee you this: nowhere else does the head of the company, who's a nurse themselves, of a company that has a nursing educational institution within it, stands in front of students, learners with us, right, and does this, and really engages and says, hey, this is important. And if we, this is what I do, and what are you going to do, right? Other, take one more, question, thought, comment. Is there any optimism around it? Not yet? You're kind of like the face. I mean, there is a reason to be optimistic for me, and that's you. Yes?
I mean, you could look at some of the optimism in the fact that we do have a lot of allocated spending that we're using these different ways and with different teaching and different allocation of those funds, we could potentially use it better.
Right, exactly. I mean, the optimism of it is that this is not without answers, right? This is not without like actual solutions. They're out there, and you can get engaged. And in order for you to be able to get engaged in solutions, first and foremost, what needs to happen with you individually? What do you need to do first? Identify the problem is good, but there's something that, yeah, raise a concern, yeah. In order to become part of the solution, what do you do first? Knowledge, correct. You become competent, right? You learn. That is your biggest job now. Learn. Learn based on evidence. Question stuff. This is what college is for. You learn. In order to stand up in any room and talk about this with your colleagues, right, at work or at a city council or whatever it may be, you have to know your stuff. And not just because you heard something on TV or some feed, click on this, some clickbait came about, or like 27 reasons for, on and on and on. Yeah, every time you click, guess what? Somebody gets paid, that's all. Yay, it's the mystery of the internet. The more you click, the more they get paid. Ta-da! So next time, you're like endlessly scrolling and clicking, think about that. But you have to actually know actual stuff and be competent in being able to deliver it then, and to be able to sort of band others together to work on solutions, right, and drive that forward. You have to know your stuff. So anytime I heard you say, weekends are no more because I'm sitting there and studying and doing my homework and all of that. Good. Yay. Laundry, outsource. Have older kids? They're responsible for laundry now. If not, ask your mom. I'm sure she'll be happy to assist, right? But you have to devote the time. And anytime you think, I'll just slide by, I'll just get that C+ or whatever the score is required. I don't know what it is nowadays, 77% on something or something like that. And you think 77% is good enough? Yeah, it's good enough for you to, pass a class. It is not good enough for you to change the healthcare system. You have to be at your best. And for a fact, I know that 77% ain't your best. It's just barely trying. Like Yoda said, try not, do, or do not. There is no try. Try not, go for it. And look, and it doesn't come easy from the first attempt, ever. This, oh my word, this is a lot of work. It is, and has been my entire life. And no, I didn't pass NCLEX on the first attempt. Oops. That was poor. Had other things on my mind. Did okay, after all. But look, so it's like, go at it again. You fail, Accept it as a gift that it is. Failure is a gift that we're never really taught to embrace. It's a gift because it tells you, not yet. Because it tells you I have to do something. I have to adjust something. I have to outsource laundry in order to have whatever it is I need in order to get to that outcome that I want. And all of you, without exception, can get to that outcome. All of you. So think about that. And again, and that's the baseline. You start doing that, learning, kind of building your toolbox, and then you can show up and do it. This is just the breakdown, and I'll send you the slides. I'm not going to spend a lot of time on this. Always love when, some years ago when the Affordable Care Act was being enacted, there's demonstrations on the streets, literal people having banners, signs that said, "Government, hands off my Medicare." Have a newsflash for everybody. Medicare is government. Yeah. Who pays for all of this already? We pay for all of it, one way or the other way. We already pay for all of it, and we pay a lot. And yet there is constantly an argument around whether to have any kind of change in the system here. Somehow we think it's going to be even more expensive. Newsflash. You've paid for it. Through what you've bought, through what you've spent on taxes, through what you pay out of pocket, all of this, you have paid for it already. This is just total spending versus out-of-pocket spending. Did I mention you paid for it? It's like, oh no, there's private business there. They pay. Where do they get their money? Yeah, from you scrolling and clicking. And buying happiness. Whatever canned form it may have. We've discussed that. Hospital care, $1.4 trillion. The vast majority of which is avoidable. Over $400 billion on drugs. Good drugs. Good schedules. The permitted schedules. We're not abusing it all. Waste. Promised you waste. Remember that? Overtreatment, low-value care, unnecessary care, failure of care coordination. Because by golly, my mom will go everywhere to a specialist after specialist until she hears what she wants to hear. And that's how we all behave. Administrative complexity, close to $300 billion. The only ones in the world that have that much spend on administration alone. Pricing failure, talked about that, right? No comparative shopping at all. Waste and waste and waste and waste and waste and waste. Estimated almost $1 trillion, up to almost $1 trillion per year is wasted. And you've paid for it. Should something change? Should the system be different? What is the biggest difference between our healthcare system and those other countries? From the system design standpoint, the biggest difference, singular biggest difference between us and the rest of the developed world. Yes? How it's paid for, yes. Exactly. It's more expansive than that. Who has access and how they have access. So what is the difference? What are the other systems called? Universal. They're called universal healthcare, meaning everybody pays and then everybody accesses it. And then the system is designed in a way to be way more proactive than the reactive system that we have, right? And a bunch of this stuff, failure of care coordination, so on and so forth, administrative complexities, over-treatment come from the absence of a universal system. Now, this doesn't mean that in all of those countries, it's the state-sponsored care, right? It's like it's done, the mechanisms of how universal healthcare can be done are several, and all produce better outcomes than what we have. Whether it's a state kind of controlled entire delivery system and entire payment system, like in the UK, or in the Netherlands, where it is not, it's privately administered, it still is universal. So think about that. Poor health outcomes. All right, well, let's dig into that, and then you tell me now, what do you think you can do? And also those people in cyberspace, you tell me as well, and then Bree, see if there's any golden nuggets of wisdom that are gonna bubble up in the cyberspace. Social, economic, and environmental factors. Let's talk about that. Anybody comes from poverty? Okay, yeah, can raise my hand as well. Yeah. What do you do? What do you do to break the cycle? Intergenerational poverty cycle. Educate. You're doing it. Welcome to the rest of your generational life. Everybody who comes after you, you're doing the biggest favor of all for them. You have decided, as tough as this is, I am going to do it. I'll fail, I'll get up, I'll dust up, resiliently push forward. I'm doing this. All right. What else? What else? Systemic inequities. Policy change. Absolutely. Policy change. And the systemic inequity, really, we got so buried in sort of looking at demographics as the sort of and saying, if, all people that belong to a specific demographic group, all of a sudden, we're going to create policies to support all of them. Newsflash, in every demographic group, there are inequities. Everybody's with me on that, right? So not all white people are really well off. We get that? Not all black people are, not well off. As a matter of fact, there's, a bunch of examples to the opposite. What focusing policies on poverty, no matter where people who live in poverty are. So those people are supported, so those people have access to the resources that they may need in order to get to health equity. That is important. Income-based inequality is tremendous in this country. And addressing that, so again, diverting resources to the communities that don't have income to support themselves is important. And yes, those communities in the United States are concentrated in the Black and Hispanic populations. That's US Census Bureau data. So that is important. Social isolation, loneliness. Oh, let me read you some stats. You'll love that one while you're thinking what it is that you're going to do to, and how can you affect policy? Before we move on from that, how do you affect public policy? You said policy, yes. Yeah, petitions, speaking to your local government, educating, doing all of that. You will not believe how many people in your government here in Alaska are clueless as to like nursing. And yet all of them vote on stuff that actually concerns the profession, all of that. Yeah, so knowing your stuff, step one, know your stuff. Have evidence behind you. Step two, show up. Educate. Talk. All right. What else? How do you change policy? What if the government is not listening? Those people just not listening to you. What do you do?
Collaborate.
Collaborate with whom?
Nursing.
Okay, good. You band together. Form coalitions, associations, so on. There's power in numbers. Because if one person shows up and talks, probably not as effective as 100. Showing up and saying, we have one spokesperson, but we're all here together on this topic, and we are here to educate and then request for a policy change. What else? What else? Okay, I'll give it to you. Be the government. You're with me? I know. I was like, I'm running. Starting my campaign now. Be the government. There's 4+ million nurses in the United States. Guess how many nurses are in the US Senate? None is the correct answer. 0. There are a handful of doctors, not a single nurse in the US Senate. Not one. 4 out of 435 in the US House of Representatives. 4. Is it proportionate to the population that we represent? Absolutely not. Because guess what? The 350 whatever million that live in this nation, everybody's counted. Kids, older folks, all of that. There's not a single kid that holds a nursing license, I can assure you, so you can exclude. So proportionately, we're nowhere near being represented. We're nowhere near being represented on the corporate boards and hospital boards and community health boards that make decisions, and decisions are being made for us and without us. We're too busy. We have laundry. I don't know. Have better things to do. such a burst of, all of the good neurotransmitters. When you finally spot it. Oh! Who's not an addict? Good. Not very many can raise a hand and say, I am not addicted to social media. It is a drug. It activates the same neural pathways in our brain that fentanyl does. The same centers of feeling tippy-top. Throw it away. And without throwing it away, just don't. Especially in school. You don't have time. Just tell your 500 friends. It's like, I am very sorry. I will be missing in action. You all will miss me very, very much for the next several whatever months, years. And with that, I delete this account. So freeing. Oh yeah, social isolation. Living in isolation reduces our chances of survival, and social isolation increases the risk for premature mortality by 29%. Poor social relationships, social isolation, and loneliness can increase your risk of heart disease by 29% and the risk of stroke by 32%. Smaller social network sizes associated with an increased risk of type 2 diabetes and other diabetic complications, including heart attacks and kidney disease. Among older adults, chronic loneliness and social isolation can increase the risk of developing dementia by approximately 50%. Being more socially connected can improve stress responses and minimize the negative health effects of stress. Social isolation, or even the perception of isolation, can increase inflammation in the body to the same degree as physical inactivity. Loneliness and poor social support have been found to significantly contribute to the development and severity of illnesses after exposure to viruses. And social media is not the network that would fix that. Actually getting out and being with people in 3D. We are biologically designed to be social, to be in groups, to be together, to do stuff together, to band together and build coalitions and change the world. And yet, climate change. Do you think climate change is a health issue? How? Why is climate change a health issue? Come on. Yes. Well, eventually, yeah. Humanity isn't like a fast track to self-destruction, so like that's that. But that's kind of like big and sort of like in the future, and who cares? Especially those of us who don't have kids. Our food, yes. Food supplies are changing because of that, because climate is changing. It's much drier in some places, much wetter in other places, so on. So the regular agriculture that's been there for 10,000 years cannot be sustained in the same places. What else? Yes?
Temperature changes.
Temperature.
Cause exacerbations of
Like heat strokes, heat deaths. Even this year, right? Like these heat waves that like one after another, earlier and earlier and earlier in the winter and the spring. Deaths, yes. Is death a health issue? Prematurely so? Yeah, you betcha. It is. What else? Diseases, absolutely. Viruses that thrive. What else? Destruction of human habitat by the storms that intensify and intensify and intensify. People lose homes. You see it all the time on TV. And after you lost your home, guess what? How well off are you? And healthy. And then it goes from there. Is climate change a health issue? It is a health issue. The National Academy of Medicine, many international bodies, nursing associations have proclaimed it a health issue that we, nurses, have to do something about. What? Come on. Policy change, yes, okay, good, good, good. But before you get to be a senator, what do? The what? Learn, yeah, okay, so you have to know how, how the whole thing comes about. Yes. Educate, yeah, educate on what? True. Okay. Greenhouse gases, ever heard of those? Yeah. Emissions, ever heard of those? Guess what? Another, where I live, Wasatch Front, it's beautiful, it's mountains and all of this, until it is not. When the atmospheric pressure inverts and it keeps all of the smog into the valley, it pushes it down into the valley, and you cannot see the next building because it's pushed down into the valley, and that's when you actually see it. And it happens every winter, every single time until the next storm comes and clears it out. We rival Beijing in our air quality or not quality. And guess what we're winning in? Leading the country. Childhood asthma. Right? And then those, not only, and this is just the immediate effect of it, right? And then the warming of the planet, like keeping a blanket over it with all of the greenhouse gases and emissions. Guess where the most come from? About half, and people don't realize. About half of all greenhouse emissions, where do they come from? The what? Not quite trash. Yeah, we pollute oceans with plastic, and then we eat the plastic, and then we're like, microplastics are everywhere. We eat them all the time. In fish, and then we're like, oh, cancer, where is that from? That plastic bottle that you just ate. Raising animals. Farm animals. And the way they're raised. Cows fart a lot. A lot. And we are addicted to our meat. Addicted to it. It's like there's no if there is not a good hunk of meat for breakfast, it's not a good day. Sausage! Or whatever, I don't know. I'm mostly plant-based, so. So I asked myself, what can I do? What can I do? Yeah, educate, do all of this, advocate, educate you, on and on and on. And then I'm just going to eat better. It's better for me, like, overall, anyway, to be mostly plant-based. And then it certainly is better for the planet and the climate and the health issues that come out of it. Gun violence, we talked about that. You think you should be advocating for, and nurses should be advocating for change in policy related to, like, sort of checked access to guns? Have a bunch of statistics on, on that 1 through 19, leading cause of death. ages 1 through 19. Most of it, access to guns at home, accidents, where ammunition and the gun is kept in the same place. And the kid just wants to play, because they've seen it on TV. Poof, 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 poof. You think? And yet we make everything a political issue, where it is not. It's simply a health issue. And if you start framing it from that standpoint and you start looking for solutions that actually are targeted to address the health implications of something, that conversation becomes easier to have. Because as we all agreed in the beginning, everybody nodded and was like, yeah. Nobody should be excluded from comparable health outcomes. So let's start including people into those health outcomes. Behavior and lifestyle, inadequate health promotion. We've talked about that. Kids are not educated. What can you do? Kids? Who has kids? Raise your hand. Okay, so about half. All right. You know where to start. Yeah, start educating them. But then what you do, look, when you hold that license, you can't even imagine sort of the power that it carries automatically with it, the respect that it commands. People do listen if only we showed up and educated. If only we went into schools. No, there's, oh yeah, there are school nurses. Let that poor person do all of it with thousands of kids running around. There's an experiment in Southern California. A school district band together with Kaiser Permanente there and went into elementary schools in the predominantly Hispanic districts and they did a few classes and they made it fun and accessible to kids, and they were like, oh, try edamame. And kids were like, what is this? And then they're like, ooh, delicious. Yes. Delicious, nutritious, cheap. So then the kids were sent home with some tools to talk to their parents. It's like, hey, I tried that thing. It has a really funny name. And here's a coupon, and it's really, really cheap. And they start changing the behavior at home through kids and some of the foods that are being consumed. So it seems maybe small, whatever it is that you could possibly do, but it's not, because it does reverberate over time, and it does, 6 degrees of separation. Ever heard of that? That you are separated from any other human being on the planet by a chain of 6 people or 5 people in between you that know each other. So you know somebody who knows somebody else, who knows somebody else, who knows somebody else, who knows somebody else. Every single person is connected on the planet. So everything that you do matters or don't matters. If you remain complacent, it matters. And if you activate, it matters. Just in different ways. Poor nutrition, lack of exercise. We're they're studying our sort of evolutionary development, and there's some studies that suggest that we will be developing this additional little bone here to help us, do this. Because this is the position of our necks most of the time. Yeah, ever notice? That's yeah. So who knows? Perhaps, over time, based on its evolutionary adaptation. Lack of action, yeah. Preventable, poorly managed chronic conditions. Talked about that. Reactive system. We've talked about that. Not focused on managing chronic conditions. Let's talk about that just a little bit. What can you do? Chronic conditions management, health promotion, diseases prevention. I mean, that school example is one of it. Who else? Who else? Because, like, come on. What do you think? Taking it all in. All right. It's like it's all swirling in there. We'll be reflecting later and distilling it down. Promoting health, what can you do? Preventing disease, what can you do? Yes?
I was just thinking, a lot of times the preventable diseases are just because they don't know.
Correct. Correct. And it's this rosy outlook that everybody has. No, despite that like really scary, ugly picture on that pack of cigarettes, well, that's not for me, really. It's for them. I'm luckier than that. And our unbridled optimism about our chances. And it's like, no. The picture is for you. Yeah. Because that's exactly, over time, where you're going to end up. Yeah, so yeah. I mean, and reiterating and reiterating and reiterating. Education is basic foundation, right, of population health management. You have to, and in order to be most effective at educating, you actually must become a practitioner of something as well, right? So you will be able, you know the nuance then. You know how to anticipate questions that may be, or objections that may be raised, right? Well, my grandpa smoked, and he was just fine, he just died from being, old. Really? Dig in. So, and yeah, if you're standing there and like, on your break, or with your kid, mommy's bad, dear. That's my mom. After. It's like, don't do. What do you think dear did? Smoked. From the age of 14, kind of dabbled at 12, really a pack a day at 14, until I was 27. And by the time I was in my mid-20s, it's pre-diabetic, hypertensive, and all of the good stuff that comes with it. Did I mention poor nutrition? And living in poverty and all of that? And having 2 Whoppers for $2 as a daily diet? Yeah. And I actually knew better already. And yet I haven't made the most important commitment that I could make at that point in time. What is that? Which commitment is that? Before you can do anything else or be effective with anybody else. Yes?
Commitment to love yourself.
To yourself, exactly. And to show up better with yourself and do better with yourself. You get there, and then you can start modeling it out. Then it's noticeable, then you're an expert in something. So serving lip service to anybody on anything isn't effective. People see right past through it. So think about that. Poor access and equity, again, get on boards. Corporate boards, hospital boards, governing boards, you can do it now. Start small. City councils, whatever it is. Health is everywhere. Policy that affects health is everywhere. Everywhere. Some populations need it more than others. Here in Alaska, which population do you think is doing the worst? Children. The what? Alaska Natives. Homeless are not doing great anywhere. Yeah. But Alaska Native population, the prevalence of substance, like alcohol and substance abuse is through the roof. Chronic conditions through the roof. Anybody Native Alaskan? Thank you for being in school and then working, hopefully, back with your community on solving issues going. I was so inspired. This was like, we're some years ago, and this was our like first foray into Alaska. We maybe had like 5 learners here, something like that, maybe 10. And I came and to give the new learner welcome forum talk, and met this Native woman, and she was in her 50s, and she was so stoked about like getting into a nursing school. And she came, I don't remember exactly the community, she came up from somewhere north, like very rural, very isolated. And so she moved to Anchorage because we could like only do it in Anchorage at the time. Now we have some possibility to do it in some other places in the state. But so she moved to Anchorage, and she said, I am going for it, I am going to do it, and then as soon as I'm done and that license in hand, I am moving back to where I'm from, and I am going to just like change the way things are in my community. But I need this education, I need the knowledge, I need like all of this. And it was like one of the most inspiring things that like I've ever seen. And hopefully all of you, right? Because you're part of a community. Whatever community it is, you're part of it. You can be the catalyst that drives ignites change within it. And then, of course, be the change first, and then invite others into the journey. Employers, right? That's the employer disengagement. You know how every year, those of you who work and have the employer-sponsored health insurance, like every year it jumps up, right? The price goes up and up and up, and employers dish it out and dish it out and dish it out and dish it out. How about you go to your employer and say, hey, can we, together with that, establish a wellness, some kind of wellness program that will reward people for, maybe lower premium or whatever it is, for healthier behavior and better outcomes. Those are available. Third parties that manage that are available throughout the country. Nightingale Education Group, we do. Our collaborators, and a bunch of them are engaged. We pay them literal cash money to be healthier and make better choices. And they do. And then it's a competition. Who gets more points? It's very exciting, right, Bree? Right. Me too. I forgot to do it today, but I will. It's very good, Sammy. Very nice. So yeah, it's possible. And over time, guess what? Our cost as an employer is way better controlled. And the cost that we don't pass on to collaborators is because of that. Because as a group, we are cheaper to insure. Because we're more proactive in managing chronic conditions effectively, promoting health, preventing disease, doing all of that. Possible, all possible. You all likely work, or most of you. Go chat with your HR or whoever else, CNO. Let's see if they're excited and want to do something like that. Start a pilot. Do some calculations. You can find data and then calculate out. These are the savings over time. Not only to them, but to the system as well. And through that change that can be driven by you through your employer, through that change, then it reverberates as well, and more systemic changes come. Because that behavior spreads out. It spreads out to the families and then to communities at large. So there is, never say, I am powerless in doing any of this. We've talked about that, right? Educate. It's not the pill that you need, Ma. How about we walk around the park once? But she goes. She's kind of afraid of me, I think, so. Litigious, again, it's consumer behavior. We show up, we stomp our foot, then if the doctor say no, like, okay, I'll sue you, because I definitely need it. Whatever it is that I may self-prescribe from, WebMD or other places. Yeah, Dr. Google, absolutely, we all are so great in self-diagnosing. Yes, I know exactly what's wrong with us. Administrative costs, we talked about that. Talked about the lack of promotion, prevention of diseases. Shortages. Shortages are real. Shortages are everywhere. And, send your friends to Nightingale, I suppose, as one of the answers. And yes, another thing, for as long as you give up, because it's gotten too tough, you will contribute to exacerbating the shortage. Continue moving forward, as difficult and tough as it may be. Oh, yeah. There is an Amazon for, prescriptions now. Used it a couple of times. It was cheaper than anything else. Not using insurance. Just for the same thing. Lack of effective health education, sedentary lifestyle, all of that stuff. All right. So in the last 10 minutes, I'll give you, Bree, I'm going to pause and see whether there is stuff out there that people.
I don't have any questions or anything.
Okay. All right. Well, if any questions or comments, if you guys want to put in the chat, then Brianna's going to read it. And for you all, take a minute to reflect, and then we're going to do something fun. What we're going to do is I'm going to take a piece of paper, and you're just going to write, I commit to blank, doing whatever, right? Based on this, my part in this, my contribution. This is what I am most definitely going to do and not let myself off the hook on that one particular thing. So take a minute. Based on all of this that I heard, I know this young lady, she's U.S. Senator. What's your name? Ashley, U.S. Senator Ashley. There you go. Sounds really, it has a ring to it, right? It does. Yeah. Hey, I tell ya. Yeah. I would say that Shneyder for Senate sounds really, really good. It's kind of alliterative. So if you ever see my campaign, vote. Probably I won't be running in Alaska, but.
But we can still support.
Oh, hey, absolutely. Yes. Send you a $5 contribution, too. I know. What will you do? Not try, but do. Don't you love Yoda? He's so wise. Those Mandalorians, I tell you. All right. And what is it? Tell me. I want yes.
Said I'm going to help teach classes within my area to help the community. Like I've taught first aid CPR classes.
Nice.
I really enjoy doing that, and just incorporating further aspects into those kinds of classes.
Fantastic. So like community health type of stuff? Yeah, awesome. Yay. And you're already a paramedic, so like there's already like oomph behind it, like oh shoot, what the word I'm looking for? The expertise and respect and all of that. So that's good. Good to use your power. Good way to use your power. Other things. Come on, everybody has to go. So like I was just, shall we go this way and then we do.
I said that I commit to being more active in teaching my daughter.
Awesome. So yay. Getting engaged with your kid more actively and, removing them from the, the scrolling device. That's like everybody can do, right? First you have to remove yourself, because then it's like, Mommy, you're not doing the right thing.
When they talk, can you have them hold this?
Oh yeah. Oh yeah. Okay. All right. We'll go here.
Awesome.
All right.
So I put that I am going to commit to doing better than I did today in my health, education, and career for myself and my kids.
Awesome. Fantastic. Cool.
I put I commit to believing in what I'm doing so that belief in positive outcomes extends to others.
Okay, fantastic. So impact, outward impact, pay it forward in the community, do things better. You're so kind.
Okay, mine is kind of selfish, but
Go for it. Yes.
I commit to bettering my overall health before I can help others.
Nice.
Because I already suffered from a heart attack last year.
Oh no! Wow.
So
For good. That's like, and look, everybody, for all of this, wherever you are, start there, right? Start here, start now. It doesn't matter where you are. You can certainly move forward from here. So awesome, fantastic. Hi.
So I'm speaking quite a bit into the future here, but I commit to making a positive difference in pregnant, laboring, and postpartum mothers' health and spiritual wellness as a nurse.
Nice, fantastic. A midwife in the making. Awesome. By the way, there's like part of the problem with maternal health and maternal mortality is if overall we have lack of providers, the lack of providers in certain communities on the midwife side and maternal health side is staggering. So it's fantastic. There you go.
I'm going to commit to completing my nursing degree and being a better advocate to change healthcare for the better.
Awesome, fantastic. Complete the degree, yay.
I put I'm going to commit to being the advocate voice for my children.
Nice.
And completing my degree.
Fantastic. Look, when you come to that commencement ceremony, and if your kids are in tow with you, it is the most, even if you don't, completing and putting that diploma on the wall, and kind of this, if I can do it, the world is yours, you can do anything, like message to your kids, yeah, just do it, yeah. Oh, that's Nike, huh? The swoosh.
I commit by implementing physical change for my health and provide like a living testimony to patients and others.
Nice, fantastic, yeah, being the model, driving that, awesome.
I commit to health promotion, exercise, and diet.
Health promotion, exercise, and diet for yourself, right? And then okay, cool, very good. I'm gonna check with all of you, in a minute. Not in a minute, but at graduation, of course.
I said I commit to learning more about preventative care that affects my local community and volunteering time at a local health service to help minority communities and those suffering with poverty.
Awesome, volunteering. Amazing thing to do to make change in the community. Fantastic.
I said I commit to focus on preventative care and effective patient education.
Okay, so focusing on preventative in your patient education, pass it that way, fantastic.
I commit to finishing my nursing degree and then advocating for the Alaska Natives within my community.
Fantastic, awesome, yay. See a theme, you know, I have to do something, and then I can do that next thing, awesome.
Well, I commit to passing the nursing class and getting my license so that I can reach out to the community and educate on physical wellness, which is something we struggle with as a state.
Yeah, nice, so. Fantastic, thank you so much. All right.
I wrote, I commit to finishing my nursing degree so that I can advocate for preventative care.
Awesome, fantastic, finishing degree. I know. Senate. Ashley for Senate.
I put that I am committed to advocating for change by being involved in decision makings, by getting on board with directors and
yes,
from there.
being on the decision making bodies. Being a decision maker is powerful, I tell you that. All right.
I commit to making impactful connections with others to create change and collaboration.
Fantastic. Making connection with others, building coalitions. I sense that. Awesome.
I commit to advocacy for my patients and being a lifelong learner.
Yeah, lifelong learning.
Educating better.
Yeah, absolutely. Look, this lifelong learning thing is for real. Never stop learning. And look, like I go around the country, I do these, and by the way, don't use the email to email me and tell me you want a great change, because I have no such power. And I will tell you just failures are right, now you dust yourself off, you move forward. But if you want to engage and connect on LinkedIn, do whatever. If you need ever sort of an advice or want to run something by me, feel free. Feel free to connect, and I'll be happy to do it. And look, going around the country and engaging in these dialogues, my favorite thing to do, literally. I don't love traveling, because I travel so much, and being in hotels is exhausting. But when I get in rooms like this and I engage with all of you, it's so inspirational, and it always tells me this, that the future is bright. Because you are bright, you're willing, you're passionate about it, you've already made commitments. So again, you asked me what the future of nursing is, and I, without a doubt, tell you that you are it. So on that, I bid you flame forward, and thank you again for being here. Thank you for engaging, and peace out, everybody. Thank you.